Thank you very much for the introduction. Thank you. And the opportunity to be here in Bulgaria and at this important conference on alternatives. So thank you to all the organizers and the other speakers, the sponsors, of course, the hosts and all our colleagues at Bulgarian universities who have begun the process of replacement and enhancing education through the use of humane innovations. Now, I'm going to go back to the very beginning and ask, what is education? What are the areas where animals might be used in experiments? To explore the different types of alternatives, I'll also be showing a video clip so you can see some of the more advanced tools and the different simulated organs that are used within veterinary surgery, for example. And then I'll be exploring what the broader impact of alternatives are and some of the resources that are available for teachers and students to find out about current innovations and to experience other people's tools and approaches and to see how these could be implemented within Bulgaria. So, Humane Innovations and Alternatives to Animal Experiments in Education is the title of my talk. And I'm first just going to give you a little taste of some of these humane innovations. Some of these you might have seen before or used yourself or seen photographs of. This is a virtual laboratory for muscle physiology experiments. This is the Sindava canine, a product that is used for a wide range of different clinical skills and surgery training. And you can see at the moment here it's being used for enterotomy, for resection and anastomosis. This is the image that advertises the body donation program, which is a national level program for ethically sourced animal cadavers in the Netherlands, which has brought about replacement of killing for animals for anatomy and other fields. And an image of the operating room with students and other professionals learning from professional surgeons as part of the apprenticeship approach that is so important within the clinic and the operating room. So the first part of my talk is going to be looking at the context and some definitions. Animal experimentation is found in separate but related fields. Education and training, which is one of the major focuses of this conference and certainly of my talk today. Research, which is the finding out of new knowledge. And testing of drugs and chemicals, for example, for consumer safety. Education and training itself is a unique field. So it differs from pure and applied science in the sense that it's not research, which is all about finding new knowledge. In education, it's known knowledge, and students are finding it, are gaining that knowledge new for themselves. Nor is it testing and looking for applied research and regulatory purposes. So it's quite different in the sense that it has a pedagogical focus and is not about science per se. But it still plays a crucial role. Humane education and training is a prerequisite for humane science, humane research and humane testing. It helps set the scene, familiarize students with what the new innovations are, and it's better education and training in terms of support for critical thinking and other skills that are so important within the scientific field. And also, education and training, of course, continues within the professional level. A lot of continuing education and additional courses for people to refine their own skills and to learn new information and so on. So education and training also continues within this area as well. Now, there are three areas where we can look at animal use and alternatives within education and training. The first is education of students and the general public about alternatives. And the primary area of this is within alternatives for use within research and testing. So you're learning about alternatives. This is an informational issue and practice. There's no direct replacement that's achieved through this education. The second area is training of scientists and others, such as technicians or assessors, in the use of alternatives for application in research and testing. So this is about scientific and technical skills. It can bring about imminent or future replacement. And the third area is education and training of students and trainees within secondary and higher education and the professional levels for the continuing education element. And education and training through the use of alternatives to gain knowledge and skills and attitudes. So alternatives are the tools for the process of education. It's a pedagogical issue, as well as dealing with technical skills, and replacement is achieved through the implementation of these alternatives. And this is the area that I'm going to be addressing in my talk today. So those are the three different areas of education and training. We can also add that in terms of students and trainees, there is the special case of training through the use of alternatives to gain laboratory animal skills for use in research and testing. This is about technical skills, and it can bring about partial replacement in the training itself. But the subsequent animal experimentation in that research and testing is endorsed and not challenged. So introducing alternatives in laboratory animal training can bring about replacement for the training element, but it supports harmful animal use within research and testing, laboratory animal use itself. So it's got some crossover with the education and training element and the alternatives that we'll talk about today, but it doesn't bring about replacement in research and testing. But it's a special case. So, I'll just go back. So looking at the educational structure, for higher education and professional levels, education and training looks at faculties of veterinary medicine, human medicine, and biology. Within those, we have the individual disciplines, such as anatomy, physiology, surgery. And within each of those disciplines, there may well be practical classes and training events where animals might be used harmfully or alternatives are used in order to meet teaching objectives for those practical classes. So this is the structure, which I'm sure you're all familiar with, but this is where the animal use and the potential for replacement is located. The majority of conventional animal use has indeed been harmful. It involves three aspects: the dissection of purpose-killed animals, animal experimentation, and other instrumental animal use, which is neither dissection nor an experiment. It might be practicing taking blood, for example. So these are the three areas where animal use has often been employed, and they are all involving harm. But I think it's also important to remember, as has been mentioned before, there are also humane traditions, often by individual country, by discipline, or by individual practical class in a specific department of a specific university. So, as you've heard, generally veterinary surgery in the UK, for example, where I'm from, is learned using non-animal methods and then work under supervision with professional veterinarians, for example, in a teaching hospital. So the tradition has been humane already, and that might also be the case for certain other disciplines, physiology, pharmacology, in some other countries. So there are also humane traditions. It's not all about bringing about replacement, because sometimes the existing practice is already exemplary, is already really good. That doesn't mean that that practice couldn't be further enhanced using humane innovations, developments in material science, in educational theory, and so on. So there's always room for improvement, room for enhancement, but the process of replacement is also very, very important where harmful animal use continues. I think it's important to recognize too that there's a lot of ongoing replacement. Really from the very early 1990s did some change begin, especially with the introduction of computer software and hardware, where simulations of animal experiments, where simulations of dissections, virtual dissections, were beginning to be produced, and also as an increasing environmental and animal protection awareness brought about student interest, student pressure to bring about change. The other motivators for change also, I think, is teachers' awareness that humane innovations, that alternatives can really enhance the quality of their teaching and make teaching easier, especially with growing class sizes, the need to manage a greater workload, to be able to distribute software across a network, to be able to monitor students' learning performance in easier ways using technology. All of those, I think, are playing a role in the process of replacement. So from the early 90s, this began. The quality of software alternatives and hardware power was increasing a lot. And in the last 10 years, there's been even greater replacement as people recognize the importance of effective ways of passing on knowledge and of students gaining skills. And the importance also of really reaching the highest levels of skills acquisition before graduation, especially in veterinary education, where unlike medical education, you've got increasing levels and degrees of specialization, all with ongoing mentorship and guidance and so on. Whereas in the veterinary case, you really have to be pretty well prepared upon graduation. So how can you maximize, how can you optimize the level of skills acquisition so that when students graduate, they are much better prepared for what they're going to be dealing with in the clinic or in science as well. So be aware that the process of change is accelerating. For many, many people, the alternatives are now the standard way of doing things because they're so widely introduced. That doesn't mean we can find whole universities where everything is humane in education. There are some, but often this is by department, where innovations happen by department because heads of department, heads of courses have innovated or have learnt from others who have already innovated. We don't need to keep reinventing the wheel, but local production of alternatives is also very valuable. However, these tools often exist in other places and are perfectly applicable and can be implemented in many countries across the world. Translations are also very important, but there are also international aspects. Luckily for me, in English, where it's important to know some international languages. But translation, of course, for local implementation is also possible. So that's the process that's ongoing. And there are a lot of really good case studies where we can see where the advantages of development and implementation of these tools have brought about multiple positive benefits for the students, for the teachers, for the professions, of course, as well. So what is humane education? It involves curricular design that enables teaching objectives to be met using humane alternative methods. It's where animals are free from harm and students have freedom of conscience. And it helps develop the qualities and the skills of critical thinking, which is so important for any scientific or health-related area, emotional and ethical literacy, abilities and skills, and the sense of responsibility as well. So these are very much these are all very important for biology, medicine, and veterinary medicine, but they're also really important in terms of society and culture too. What is harm? If we're talking about replacing harmful animal use, what indeed is harm? We define it as any action that impinges or impacts on an animal's current or future well-being by denying or limiting the following freedoms. The freedom to live, because taking a life, having your life removed, is a significant form of harm. It's not just the process of killing, it's also the fact that you are no longer alive and no longer have that potential. So the freedom to live is a very important freedom. Freedom from pain, injury, and disease, which is the classic ideas of what harm might involve. And we have other freedoms that are listed within our policy. And you can see our policy at interniche.org. It's a detailed policy, but you can also read a number of articles from us and from others that explore the nature of harm in more detail. Now, of course, this is a very strict definition of harm, especially when you read all of the elements of our definition, but that doesn't mean it isn't something to aspire to, nor does it not mean that we can't achieve it. And the examples that I'll be showing when we look at the different types of alternatives and what has already been done at many universities, many university departments across the world, have demonstrated that it can indeed be achieved. A completely harm-free education. And that's not even mentioning all the additional benefits in terms of pedagogical quality. But harm is not just what happens to the animals. It's not just the practical class, it's also the issue of capture, the harm, the ecological impact of frogs being caught in the wild, of cats being killed and shipped from Mexico to the US, of other areas. There's a lot of harm involved in capture, in breeding too, in the transportation, the caging and the keeping of animals, the experiment or the killing itself, preservation, in terms of environmental impact, for example, and what that means for us and other animals, and the disposal process as well, in a similar way. So when you look at the whole picture, when you look at the whole life cycle, then you can see that the harm is even further than just the practical class, and is much broader in terms of its impact. Now, there's a lot of courses where you can learn about alternatives, or the 3 R's of replacement, reduction, and refinement of animal experiments, or learning about ethics or bioethics and animal welfare. And these are all really important courses that people should be studying in their biology and medical and veterinary degrees. And it's really important that it's good that they're growing and that they're being implemented. And of course, that the quality is often very, very good. However, if you're learning about animal welfare, learning about alternatives in one class, and then in your next class you're doing a dissection of a purpose-killed animal or an animal experiment, then the lessons you've got from your animal welfare course, from your ethics course, can be limited or even negated. And it's certainly inconsistent, you can see that. One message in one class, a completely different direct or implicit message in the next class. So let's recognize the value of these additional classes about the topic, but make that consistent with the practice so that animal welfare is put into practice through the use of alternatives and the replacement that's been achieved within the practical class as well. So I think that's very important to bring about replacement too, and these two things need to be parallel. Now, most of you will, of course, have heard about the 3 R's developed by Russell and Birch back in 1959, and which became very big in the 2000s and since, as a way of trying to minimize harm, but also to bring about replacement. Now, are the 3 R's helpful, or are they relevant for education? We can look at them for research and testing, but my focus is education. I would say that because the 3 R's comes from a laboratory animal perspective, a laboratory animal science perspective, rather than a pedagogical one, they have limited relevance. Okay? But still, even within the 3 R's philosophy and practice, replacement is the main aim. It is what should be aimed for. Many people who are doing animal experiments want to only look at refinement as a way of giving a nod to the 3 R's, but in fact, replacement is the aim. And certainly now there's a huge potential for replacement and much already achieved within science, within research and testing. And within education, if we look at the potential for replacement, we can see it is clear. In every class, for every class, there are alternatives that have been developed and implemented somewhere. So replacement is feasible, it's desirable, and so we don't need to be looking at reduction. We might start off with partial replacement, but it's still replacement. We don't need to be looking at refinement because replacement is achievable. So again, another critique of the 3 R's and a need, I think, for us to focus on the 1 R of replacement. Instead, perhaps we can redefine the 3 R's for education to see that full replacement is feasible. We can redefine it to be, so that's stricter. We can redefine it to be smarter, to recognize also that it's not only non-animal models that can be replacements, it's also work with individual animals where no additional harm is caused. For example, an animal that has to be put down for medical reasons that could go into a body donation program. Okay, that's still working with animals. Clinical and surgical work with animal patients, again, causes no additional harm and is to the benefit of that individual animal within a veterinary teaching hospital, for example. So again, you're working with an animal. It's not a non-animal method. It's working with animals, but with no additional harm, and in some cases, like in the hospital, with actual benefit to those individual animals. So alternatives for us can also involve animals themselves, but not involving harm, and that's the key issue. We could also think about retirement. Can the 3 R's be retired? And instead we can focus on enhanced education and training. And certainly within research and testing, as you've heard already, the acronym NAMS, non-animal methods or new approach methodologies, are now very widely used. And in fact, the word alternatives is hardly used at all now. It's NAMS because these are new approach methodologies that are better for research purposes, better for predictivity, toxicology, work within testing as well. Generally within education, we're still talking about alternatives, but I think it's important to recognize that the word is an imperfect word. For some people, the word alternative sounds like a mediocre approximation to the real thing, where actually that's really not the case, and I'll be explaining why throughout my talk. In fact, with this slide, because the real thing is actually the key issue here. So this is a myth that animal experimentation is the real thing, and how I've just described some people's perception of alternatives as just something that's trying to be the real thing, but isn't really there, has its issues. You know, if we have to have a more ethical approach, okay, we'll use an alternative, but we don't really want to. That's the attitude of some people because they think that the real thing is the animal experiment. In fact, and also that alternatives are not. In fact, this confuses the method with the objective that might be happening within a practical class. So animal experimentation is just one method, okay? It's just one approach. The real thing is actually the effective gaining of knowledge and skills and attitudes. That's the real thing. That's what the focus should be on. It's a pedagogical issue. It's how well you learn and what you're trying to learn, rather than being attached to a certain method, which is not what you're trying to achieve. You're trying to achieve an objective, to understand muscle physiology, to understand comparative anatomy, to be able to think really clearly, to have the technical skills for basic levels like psychomotor skills, eye-hand coordination, being able to suture and use different instruments, right up to more complex processes and procedures that you can do competently and confidently. That's what you're really trying to achieve. Those are the objectives. Then you think, okay, what are the different tools and approaches we can employ in order to reach those objectives effectively? It's not following and being attached to a certain method. It's looking at the evidence, it's thinking creatively, thinking holistically in order to employ the best tools in order to get there. So in summary, this is not the end of the talk, by the way, this is just the end of the section. In summary, it's a matter of curricular design, of defining teaching objectives, the choice of tools and approaches that can enhance the acquisition of knowledge and skills and attitudes. Oops. So, that should go back. Hang on. Okay, so what are the different types of alternatives? You've heard some of this before. I'm going to present it as we see it and give some additional examples. Firstly, what are alternatives, our definition? We say they are educational tools and teaching approaches, such as working in the clinic with patients, that replace harmful animal use and meet teaching objectives. So in many departments, these are now the norm, as I've said. And there are a range of different tools and approaches, but we can have a quick reminder that these can involve both non-animal tools and work with individual animals where the animals either have, there's no additional harm, and it might be, we could consider it to be ethically neutral, or the individual animals benefit, like being in the clinic. So two types of tools and approaches, the non-animal methods and the work with individual animals that involve them. Then these are the different types: film and video, models and mannequins and simulators, computer-based simulation and augmented reality and virtual reality, ethically sourced ethically sourced cadavers, organs and tissues, because that's also done in human medicine as well, and we're covering all faculties here. Clinics with patients and also volunteers, student self-experimentation, in vitro laboratories, and ethical field studies, for example, within biology classes. So these are the different types, and I'll be looking at these in more detail one by one now. So film and video, of course, is the recording of a professionally performed dissection or experiment. And as you heard earlier as well, what you have here is a chance to see something that's done in a very good way, rather than having all the additional challenges that a student might face in terms of resulting in a poor learning experience from their lack of understanding at that stage of their education. And so here you have a focus on things that have been done well, that go well, so actually you can focus on what you're really trying to achieve: understanding structure, comparative anatomy, and so on. So it's a better environment for learning. And of course there are recordings of dissections across very, very many species, and you can use such digital resources in your own new resources that you make, whether it's a PowerPoint or a new alternative tool. The drawback of such video alternatives are that they are passive. So you're not actively engaged in anything with your hands or an interactive activity with the software itself. But that doesn't mean there aren't other ways of interacting, and we'll be looking at that more with the computer simulations. So it doesn't matter that there's a drawback with video, because all the time teachers will be thinking, what are the range of tools and approaches I can implement in order to meet the teaching objectives I define, or the additional teaching objectives I want to add, and in what order could they be, which types of tools, and there'll always be a combination of tools that are used in education, from books to advanced software and advanced mannequins. So this is really good for one stage of anatomy learning, for example, and then there are other tools that you might use in the same class or afterwards, which can bring in other ways of learning, other elements of that knowledge that needs to be gained. So it doesn't matter that it's passive, because there will be other active elements in other classes for the same discipline, and then of course for when you really do need hands-on experience of certain organs, or even the real animal organ as well. Again, all of those can be done in a way that is fully alternative. Models, mannequins, and simulators, and this is going to be quite a big section because it's quite a wide area. Of course, models have been used for hundreds of years to illustrate anatomy. Out of wood, out of rubber, out of plastic, out of paper mache. There's a wide range of ways to illustrate anatomy, to have models that can be taken apart, to have labels. It's a typical thing that's been going on for centuries, and there are, of course, advanced models with new materials that you can also link in with some software, such as augmented reality approaches. So here we have a gentleman from 150 years ago or so, a little stern perhaps, but otherwise still using alternatives, although I'm sure he didn't use the word alternatives. He just wanted a good model of the human body, and here's one that he made or bought. This is a model of a horse that's in a museum in the UK from a German company that makes a lot of anatomy models, handmade models, hand-painted models. And again, you can take this apart and you can understand the sort of spatial relationship between organs. Models like this are hands-on. They're not digital, but they are very, very useful as one of the many different tools you can use for gaining the range of skills you want, so the range of knowledge and skills you want within anatomy, and then going on to clinical skills work too. You can also work with plasticine and clay in order to build up the anatomical structures of an animal. And of course, in this way, what you're doing is, in a slower way, you're understanding the different forms of different organs and muscles, and you're building them up and looking at the spatial relationship between different organs and layers of muscle. And it's a very active and creative approach that also builds up the body rather than takes it apart, like a dissection or even a dissected model or a software dissection even. So I think this is a very interesting approach because it's more creative, it's slow, it gives you the chance to sort of learn in a very creative and positive way. And I think, again, in combination with models and, of course, software and ethically sourced animal cadavers as well, you get to use a number of different approaches, a number of different types of model, and that can build up your anatomy education in a very effective way. And it's also worth remembering now, I think, also that different people learn in different ways. There's a whole range of different methods of learning. Some people are more visual, some people are more cerebral, some people learn from very much doing things and having hands-on. So when you use a range of different tools rather than just the same old conventional dissection, you actually make your education more accessible to the wide range of different psychologies and learning styles, including sort of being more or less neurodiverse, and the different skills that neurodiverse and everyone has in different areas of their minds and their ways of learning. So a range of tools is very important, I think, in terms of everyone having experience from the value of each of these different models, but also for increasing accessibility for people who have a predisposition or a skill in a certain area and less in another. 3D printing, of course, is very important. You'll be hearing much more about this from the experience in Sarajevo with Dr. Bedic. And 3D printing, of course, is a much more new technology, but rapidly evolving in terms of the degree of flexibility and the diversity of material types of what can be 3D printed. And this can cover everything from printing bones locally. You don't necessarily have to buy from an international company, get it shipped, deal with customs. You can produce it in your own department, especially if you share your printer with other people and share the cost. Right up to some more flexible models like suture pads, building up organs, multiple layers, and so on. We'll hear more about this later, but 3D printing is something where there's a lot of potential for making models locally for anatomy, for clinical skills, and for surgery to some degree as well. Then out of other models that you can buy, we're looking at clinical skills and surgery training. We're looking at a very, very wide range of skills that are and skill sets that evolve over time, over the years, over the semesters, over the particular classes. And at the very, very basic level, you don't know how to hold a needle driver, you don't necessarily know how to correctly work with your scalpel or your needle. So a very basic model is exactly right for that the basic skill. So the question of fidelity, the level of realism, is very important. You don't necessarily need a high fidelity model for everything you're doing in a university, in a life or health science class. You need one of appropriate fidelity, the right level of realism for what the teaching objectives, the skill sets are in that particular class. And at the basic level, you're dealing something even more basic than this, just a simple silicone or rubber pad where you're looking at eye-hand coordination and trying to build up muscle memory. And I interviewed a professor from Colorado State University who said, it may be just a saying, but you only need to practice a skill badly 50 times in order to have that bad practice with you for life. But to learn it well and have good practice, you need to practice hundreds of times. So it's easy to get it wrong and then to be wrong for most of your profession, or to have to relearn something and adapt everything. But if you get it right from the very beginning, then you're going to be prepared for everything else. The basic skills are really crucial. Once you've got those mastered, and models like this, simple models, are really good for that mastering because you've got something of sufficient realism, sufficient fidelity, and you're focusing on those basic skill sets, the basic skills you need to learn. That is something that you can then apply in many other areas, many other processes and procedures that you're going to do later, and you'll do those better because you've done the first ones correctly. So working with basic models like this for basic clinical skills, surgical skills, is very important, and there's a wide range of tools. This one here has 5 layers. You can get 7-layer suture pads as well. You can see there's a tube here because you can have resting synthetic blood, so you can manage bleeding as well. That's very important, of course, for all elements of surgery, management of bleeding. And there's also more pink and more brown suture pads to reflect the multicultural reality for humans. And also you can have different models that are relevant for different species as well. You can have models like this, the rabbit ear, so you can practice how to take blood and give injections on a simulated rabbit ear. And what's so important about models like this is that you can practice and practice and practice again. You can make mistakes. You can make mistakes while you're being mentored, while you've got that supervision. And so you're not in an environment that's not conducive to learning well. There's additional stress because there's an animal that might die, an animal that's being killed, with issues that are not being discussed, ethical issues that are not being discussed openly, which is self. itself has a stressful impact on the student. And you can work in an environment where the focus is on very specific skills without the distractions and diversions of the animal lab or other poor teaching and training tools. And then you work building up your confidence, building up your competence, and when you as a student and your teacher who's assessing you think that you have reached a sufficient level of confidence and competence, you can go on to the next stage. And there's a wide range of different stages and tools that can be used to build up those skill sets and go from the beginner surgeon working with how to hold the instruments right up to someone who not only can manage a specific technical procedure, but can also do that under stress. But there's no point adding unnecessary stress at an early level. Even the issue of stress management can be done in a fully humane way as well. And I'll explain that shortly. This is a model for practicing castration and spaying. So you can work on a model, you can practice in advance of doing the real thing with an animal patient. And of course, such models exist for human medicine as well. There's even more models and mannequins for human medicine, mostly because there's more money, but also because of the fear of litigation. If you get it wrong, you can have a big problem. So, especially in the US, where litigation is such a big thing, you really want to make sure that your level of training is at the highest level possible. And this is why many of these tools that we could call alternatives have been developed, is to make sure that the level of training is as high as possible. So you can practice your spaying neutering. This is after you've worked on basic models where you look at how to hold the instruments, of course. Then where you're working on this as a spay neuter model. Maybe you'll work on a number of different spay neuter models. And then after that, if you're good enough, you might be then working with animal patients. And that can be going on. Oh, we have Jerry appearing. Yes. That might, of course, be going on with a range of different options, like working with shelter animals and so on. But we'll talk about that in a minute. This is one of the Sindava human mannequins. And Sindava is a US-based company that has done some really great innovations within materials science in order to develop models for a very wide range of clinical skills and surgical training. And you'll be seeing a clip shortly of the Sindava canine, which is not Jerry, who's just appeared here at the front, trying to steal the limelight from me. But he's a good dog. And the Sindava canine is another good dog. And you'll see the range of different functionalities that such models can use. So this is one of the human models. And this is the Sindava canine. Well, we'll be looking at a video clip shortly. And we'll be showing the whole summary clip of the film episode we've produced, subtitled into Bulgarian tomorrow during the demo session that I'll be doing. The clip I'll show today is just 2 minutes and is in English. But here you can see a bleeding spleen on the left. Or is that the liver? No, I think that's a spleen. So you have a number of different organs. You can have circulating blood with pulsation. You can see here we have intestine with a foreign body. And these are highly realistic. And this level of fidelity is great for the advanced surgery, of course. So you can work through your basic surgical skills training, your intermediate surgical skills training, and then more in the latter years of your education, you can work on advanced models like this. If you can afford the dog, that is, it's quite expensive, but it lasts decades. So as long as you can replace the used parts, it does still work as a very good investment. And this is maybe the next stage after the beginning and intermediate stages before you work on real animal patients. And it's highly realistic, and you can arrange a whole range of different processes and procedures that you're going to be practicing. This is a still from some filming I did at Cornell University in New York State, and this is what we'll be showing as a case study in the film episode. And here you can see the mentorship by the professor with the two students, and they're doing, I think in this afternoon where I was also filming, they did 3 different labs. They did a cystotomy, they did a enterotomy, resection, and anastomosis lab, and then they did an emergency lab linked to an ovariohysterectomy where a vessel started bleeding, and they had to not only find the vessel and tie it off, but they had to deal with the stress of this sudden emergency. And it was a controlled environment, and there was no animal at risk. So that was also good for the students' learning. But once the students had actually practiced that, they knew that they were able to cope with that emergency, to cope with that procedure. And as one of the professors who helped develop this model said, his aim is that the students fail in the lab, because then they can really learn from their mistakes, learn from their failures, and when they come to work with real animal patients later, they'll have already been through that. They can think, okay, this is actually quite easy, I've done this before. So it gives the opportunity to learn so much more. And I think that's one of the really important messages with alternatives. These learning tools, often designed by teachers themselves, present a greater sensitivity to the learning process, which is a more complex way of saying you learn better, because you can think of what the teaching objectives are, what the skill sets are, and how best to achieve them. Here's a close-up of doing the enterotomy and the anastomosis. And as I mentioned before about processes, you can also use these models for practicing anesthesia, or for learning how to approach the dog when you're going to do a castration. So not just specific procedures, but also the whole process that is part of that procedure, or is linked to that procedure. And models that are more complex and expensive like this can be really great, but you can also use very, very simple, inexpensive, homemade models for learning of certain processes. And I was doing some filming in Copenhagen in Denmark, where there's a fair amount of money in the country for developing and buying alternatives, but this surgical training lab, this surgical skills lab, was very, very low cost. It used toys bought from IKEA, animal toys bought from IKEA. It used balloons, it used condoms, it used rubber bands, it used mayonnaise. And this was sufficient for practicing a number of different procedures, like how to approach the dog from the right side if you're doing a castration, how to identify the position of a certain organ. And so they had a whole hall full of individual stations with these individual bought and then adapted, simple, low-cost models that were all excellent for and had just the right level of fidelity and realism for the specific procedures and processes that needed to be learned. So the Sindava canine is expensive. It's great if you can have it, but be aware that the range of costs of alternatives can be everything from zero to very expensive, and that you can make a lot of things yourself and they'll still be excellent, maybe even sometimes better. Here you can see more of the inside of some of the models that are made by Sindava in this case, and I think this is the trauma man used within human medicine. And of course, in both of those situations, you can also practice emergency care, so the bringing about of a heart attack or other sort of crisis that you need to, again, manage in that stressful environment. Now, these two clips here are mentioning, again, the sort of processes that you can learn, but also what additionally you can do. So this is Jerry. This is also Jerry. They're related. They've got the same name, but this is another Jerry, and this is a different department at Cornell, where this professor, who came from a more engineering background, adapted Jerry for use in a clinical pharmacology lab. So he's adapted everything. He's using a heart pump and a heart monitor and to look at respiration. And what happens is that the students, there's 2 students who work in the lab here with the dog model, the adapted dog model, and there's a classroom of students next door, and the teacher presents a case, a real-life clinical case from a dog, and the students in the lab here have to work out what's gone wrong, what to diagnose, and then apply the relevant drug, for example. Meanwhile, the other students can reflect on what those students have done, and they can all meet together in a very cooperative and non-judgmental environment to see how anyone could have done anything better. And that's a very good way of exploring that sort of clinical pharmacology and broader diagnostic and therapeutic approach with animal patients in a way that is very creative and gives all the benefits of these different tools, from a case study to an adapted mannequin to the collective reflections of the students and the wisdom of the teachers, in order to improve the quality of the teaching. Okay, and of course, as you've heard and as you know, there's a lot of clinical skills and surgical skills labs being developed because people recognize that these are ways of learning more effectively. And so you can now see a wide range of labs in veterinary medicine, and of course in human medicine they're much more common already as non-animal methods. That really, I think, also shows how these tools and approaches are no longer seen as alternative, but are just better ways of learning. Okay, so there's not so much time, but I've got quite a lot more to say. So let's just see how fast I can work. Multimedia computer simulation as the next type of alternative. First, we have anatomy. You can have a multimedia anatomy program where you've got virtual dissection. You have overlays. You can look at the microanatomy, the labels, comparative anatomy, different magnifications, of course, as well. And that's one type of software for anatomy. Another type of software is the images taken of a real dissection, then incorporated into software, where you have maybe dozens, scores of different high-quality images, different magnifications, degrees of labeling, and you can identify structures through the menu or the image, and then find out more information as well as having a VR aspect where you can look at things in a more 3D way. This software has also been adapted into a virtual reality anatomy software that the students are using. So this is a second type of anatomy software. The third is the anatomy software where you're looking through a body and you can dissolve different layers of the body, such as the skin, the first layer of organs, then down to the skeleton. And this is also a way where you can build up the body and take it apart again, look through it, and build it up again. I think that is also a less violent or a less invasive way, even in the simulation sense. So again, I think taking apart is one way of learning about anatomy, but being able to look through and build back up again is another aspect. And that has deeper and positive lessons, I think, in terms of not having such a destructive approach, which has often been the case with anatomy. But in combination, each of those approaches has its value. We have the virtual laboratory, which is much more interactive. Here, students are much more engaged. They might be more self-directed. They can make mistakes. They can go back again. They can check they've learned something by going back and forth. And this is really important in terms of gaining the knowledge. And this is a simulation of SimNerve, which was produced at the Institute of Physiology at Marburg University in Germany. And this is really good in terms of simulating the classical frog nerve, frog muscle experiments. And this software is available free for students. Faculties have to pay, but it's free for students, and it's very, very good software. This is SimMuscle. I say you can do everything, and teachers can even check whether you've copied your data or check that you've really understood the process through the feedback mechanism. So it gives an extra opportunity for that both monitoring but also helping teachers guarantee that students really have done the work and done it well. You have animations such as the glass horse, where you can understand not just the anatomy but also how various conditions develop and grow, but also then how you can do examinations in order to identify various pathologies. And hopefully I'll be able to demonstrate some of this tomorrow. And you have apps where you can, on your phone, revise certain clinical skills and surgical procedures before an examination, for example. And then full augmented and virtual reality is much more immersive, where you have more senses simulated, and either wearing a mask or being in a certain room, and this is more common in medical surgery, but also increasingly being available in veterinary. You have all those senses for a much more immersive environment to be able to practice procedures, and that's very important. And this is the haptic cow that you saw earlier, combining a mannequin with advanced software and bringing the benefits of technology in multiple areas to support the learning process. Then we have the ethically sourced cadavers and organs and tissues. This is the national program I mentioned from the Netherlands, where clients of veterinary clinics, the general public, can donate the body of their deceased companion animal if the animal had to be euthanized for medical reasons, so for its own benefit. That's the real meaning of the word euthanasia. It's often used incorrectly within science. The animal doesn't have to be killed, but in some cases you really have to put down an animal, or there's an accident or a terminal disease. So you can donate this animal into the education system to provide both fresh animal tissue and also have preservation as well. So that's very important for anatomy, to some degree also pathology and some clinical skills and surgery, depending on the use. Body donation programs are the main way for this. We also have a little flexibility for animals that are not free living and who died in the right way, as we define it. And you can see this within our policy. That's where there aren't free living animals like horses or camels in places. So there's a little bit of flexibility, but still the animal has to die in an ethical way, we could say. You can then preserve these specimens, humans and animals, different levels, and plastination is one way. This is material produced by the El Nadi technique, which is a low-cost preservation method, and you can see online in our databases, for example, on our website, about how to use this low-cost preservation method. And that, because the specimens can be more flexible, you can also increase the potential of use within clinical skills and surgery as well. You can also have pulsation and perfusion, the pop trainer, where you have waste organs inside, ethically sourced, we would say, and maybe in 2 or 3 years, 3D printed with high-quality, high-resolution vessels for laparoscopic, minimally invasive surgery, as well as general surgery. And you can simulate bleeding here because you have circulation and pulsation. So it's very important. And this is now pretty much the gold standard for surgical training in laparoscopy across the world. So it's already implemented, already seen as a standard way of learning, but it's also good for veterinary medicine as well. This is Dr. Emad Aboud, who developed Aboud's method, and he's a neurosurgeon, and he trains mostly with human organs. In this case, he's working with a head, training in neurosurgery. So another way of adding pulsation and perfusion to an existing human or animal specimen. Working with patients, of course, is crucial. It's typical within human medicine, but you have all the different levels of being an intern, a resident, a consultant, whereas in veterinary medicine, as I mentioned, you need to be pretty competent upon graduation. So, as you heard earlier, the opportunities with animal patients in a teaching hospital and a private clinic and a shelter is really quite immense. You've got a huge potential for students to practice and learn under supervision after they've gained sufficient skills on non-animal models in order to further refine their skills and practice procedures and help the animal at the same time. And this is often so much better than the animal experiment. It's also case-based, so it's realistic, experiential training. You get to see everything from the meeting the client, the diagnosis, the whole procedure, and then later on, of course, ensuring that the recovery and the post-operative care is good. So it's very comprehensive and holistic in terms of the range of skills and the range of things that you can gain as a student. You also learn caring as a clinical skill. Often emotions are seen as either just in the way or unimportant or just to be added on sometimes. But actually, caring is an essential clinical skill. It needs to be there in the center of your clinical skills and surgery training. Otherwise, you're just not going to do a very good job. So caring as a clinical skill, I think, is crucial. It's an essential skill for vets as well as doctors, of course. You can more likely to be better in your diagnosis and your treatment. And when you're using alternatives, tools and approaches, you will actually support the development of that skill. You can work with animal volunteers as well. So this is body painting of horses to understand biodynamics, for example. And it's a non-toxic paint, and the animal gets rewards for the interaction. Any discomfort, and you stop the practical. So it's something where the animals can benefit, but you can also understand how the bones move, and it's a sort of living anatomy lesson. So that's very important. Self-experimentation is another type of alternative. And I know we don't have so much time. But anyway, self-experimentation, doing work on yourself, on your fellow students in a non-invasive, consent-driven way is very good. And here you see what's called the Biopack Student Lab, where students can give themselves minor electric shocks and look at the nerve response for nerve conduction velocity experiments. The same thing you would be doing on the frog nerve and frog muscle experiments, you can do on yourself. As a human medical student, of course, you have the appropriate reference object, the human body, and you're having fun. You're more likely to remember the principles, to enjoy your class, to enjoy your education rather than reflect back on it and see and just have bad memories. But it's also good for veterinary students as well, because we're all mammals and we can learn from this too. And in combination, working with software, a virtual laboratory, combined with doing it on yourself. Go away. She's creeping close. You get two very different tools. I will finish in a minute. Two different tools that together can really do better than the animal experiment. You can work in vitro. Cell respiration experiments, you can get mitochondria from potatoes, from beet, from turnips, instead of killing rats for their mitochondria. There's a paper, you can read about that. So there's lots of work in vitro where you can use ethically sourced material or even plant material, say for biochemistry, and that's very good. It also gets you familiar with these sort of approaches because while there's a growing field of humane research and testing. And then finally, out of these types of alternatives, we have ethical field studies as biology students getting out of the lab into the field. Observation is often has been played such an important role within science education and science itself. So I think seeing animals, observing animals, seeing them in their ecological context is very important as a zoology student, as an ecology student. And that's certainly an area where I think there could be a lot of opportunities to further develop both new practical classes, new field work, but also replace some of the harmful animal use. So that's the end of that section. However, let me just see what's next. Hang on. Hands-on experience. Okay, I'll just tell you this myth. there's sometimes the myth that if you don't use animals, you're not going to get hands-on experience. I hope you understand that through the different types of alternatives, including ethically sourced cadavers and clinical surgical learning opportunities, there's plenty of opportunities to work with real animals, to get your hands dirty. If you're objecting to harmful animal use, it doesn't mean you don't want to become a vet, don't want to get your hands dirty. No, you're objecting to the unethical practices, and there's plenty of opportunities with real animals that you can do. So first we have to ask, is it relevant? Well, medical students, no. I don't want a doctor who's an expert in frogs. I want them to be focusing on humans. Secondly, replacement can involve animals through the ethically sourced cadavers and the clinical work. So that's really, really important. Now, we unfortunately have to have, how hungry are you even? Pardon? Not at all. Oh, well, that's good. I suggest we just watch this 2-minute clip and then consider having lunch. Okay? Is that all right? So could we
Going further in, we're going to go ahead and, in this case, if the abdominal plate was opened, we would exteriorize the intestine. And again, as a good surgeon, you are thorough in your exploration and will feel of the intestine and determine that there are certain irregularities here that you don't want to miss. So as you go further in, lo and behold, here's a foreign object. So it feels kind of like a dice. How would I deal with this particular thing? Well, you would do an enterotomy. So at this point, you would cut, remove that foreign material, sew it up. But there's another issue here too. There's a pathology, an area of irregularity, perhaps damage that was done by the dice. So this would guide us to consider this area an area where I would do an anastomosis.
What is going to be the preservation of your blood supply? And this is the hardest portion to figure out, I think, with a resection and anastomosis. Twofold is where to cut and what blood supply to save. And so, again, if we're pretending that we need to remove all the sutures of the enterotomy, what arcades need to go and what arcades need to stay. We have great blood supply from this jejunal arcade to supply this from this end. So then in theory, if you want to save this, right, where would you place the ligatures? Because we want to also think that we're going to want to make our cut away from the mesenteric surface at an angle, right? Yeah. We don't want to make it this way because then the tip of the blood supply is going to be poor here. So the way that you do have your carmelets placed is appropriate. You want to actually pretend like you're placing a suture almost at the base of the intestine and ligating so that it's not bleeding. And it actually is like a very prominent artery that'll spurt at you, and so they can be a pain. So I find trying to create an environment for success before you cut the intestine is important, because once you cut the intestine, you're trying to get it back together as soon as you can. So plan, have everything set, then cut the intestine.
So that was a clip from our forthcoming film, and that's a case study of the Sindava canine, this high-fidelity model. And tomorrow, with Bulgarian subtitles, we'll watch the summary clip, the 20-minute clip of the whole episode. And over time, we'll be producing the other episodes, which cover everything from the preclinical areas of fields of veterinary medicine right up to work with animal patients. And covering low-cost or zero-cost tools from around the world as well. So we'll have a lot of lessons from teachers who've already developed and implemented these tools in the other episodes. And tomorrow you'll see this clip, which is the focus on the Sindava canine for the advanced and abdominal surgery. So I've been told I could have another 5 minutes to finish off, and then we won't have questions and answers, but you can come and chat to me. Or I can cover some of the rest of my talk in the demo session tomorrow. Would you like 5 minutes now, or shall I do that tomorrow? Now is okay? Okay. So, the Sindava canine that you've just seen, sorry, that should be the last clip. So just reflecting towards the end of the talk then on the teaching objectives and the broader impact. Firstly, we have the standard teaching objectives, which can be met better when you audit courses and you think of knowledge and skills acquisition and you look at the published studies showing the benefits of alternatives, then you can see that not only can you meet standard objectives better, but you can also meet new teaching objectives. Objectives from thinking about the curriculum, the use of innovative technologies, mastering new surgeries you couldn't do with the experiments, and developing caring as a clinical skill. So these are additional objectives you can meet. You've also got the hidden curriculum, the implicit messages, often negative, that harmful animal use might present to the student, like habituating the student into instrumental animal use, seeing animals as disposable tools, desensitizing, teaching conformity rather than critical thinking, and so on. And alternatives can obviate or remove the lessons of the hidden curriculum. It's also more, when you use alternatives, you're more connected to life science philosophy. Biology is the study of life. Medicine and veterinary medicine is a healing art and science. And you're teaching critical thinking. So you're closer to the roots of the education system and those faculties. Emotional literacy, sensitivity, compassion, you're more likely to encourage those and not have desensitization and lose them. You can be emotionally competent. There's a lot of mental health problems within veterinary profession, for example, so you don't want to add those with harmful animal use, and you want to have students who are able to deal with their emotions, including in stressful environments. And again, alternatives can help that. And desensitization actually can stunt or limit emotional literacy. So there's an ongoing opportunity for personal and interpersonal and professional growth in terms of emotional literacy too. Ethical literacy too, you can become familiar with that there are ethical issues. You'll become more able to deal with ethical issues in the professions. You could start practicing this as a student, and of course being open about what the ethical issues are in education is a good start for that. And using alternatives is solving those ethical issues. So again, good practice to happen in education for all the benefits to students and animals, but also good practice for the professions. And then you have your accessibility and inclusivity, learning styles, moral views of animals, religious perspectives. That can all be accommodated. You can be more free in terms of your individual conscience and your civil liberties. The reputation of individual teachers and universities can be enhanced through investment in innovative approaches. Animals, of course, are free. Your ecological impact can be improved. And your social impact, because you'll have better trained doctors and vets entering the professions, will be enhanced as well. And finally, economic benefits, because you can save money with most alternatives, and the investment is also something that you will start reaping within the faculty and within society afterwards. You can also produce and sell alternatives locally and internationally, and you can make some alternatives for free. So economically is better. And finally, legislation. You can be more in accordance with legislation that says replacement should happen if it's possible, and the broader range of objectives that you want to achieve within education can also be met, and that is reflected within legislation and guidelines too. So finally, we have what we can offer, our book, the documentary, another book to come, databases and our website, an alternatives database with over 1,500 tools that you can access, that you can read about and click on and buy then directly from the producer. A studies database with studies on the topic, where you can read the reference and the abstract for individual studies on the topic. You can borrow items from our loan system. You can see Jerry here. Jerry's been in Bosnia for a while, and now he's coming here to Bulgaria, so you can borrow Jerry. We sometimes have small grants available, and as you heard from Dr. Filipova Diljana earlier, there's a project for Eastern Europe where Doctors Against Animal Experiments and Interniche have provided some laptops and projectors and software and models as well. So sometimes there are funds available. You can find support for conscientious objectors on our website. There's events like this that we're very happy to be part of. And we also have, you can also get resources from other people. The virtual physiology that's free for students, I mentioned earlier. Other information resources. Think about collaborating between graphic designers, physiologists, computer programmers, because there's a lot of skills elsewhere that you can combine to make new tools and learn, get inspired with one tool that could be used in another area as well. So there's a lot of transferability in terms of skills and resources and ideas. And then there's the Lush Prize. You heard that the Lush Prize is a supporter of the conference. Over £2 million has been distributed. There's the current application open till the beginning of December. If you've achieved something already, you can apply for the Lush Prize and you can be considered for a reward for that work. You can start doing a project now, and in 2 years, you can apply for the next stage. So, in conclusion, final slide. Alternatives are superior to harmful animal use, especially when you think about combinations of tools and approaches. We believe that 100% replacement is possible. There's a diverse range of tools and approaches, and there's alternatives for every practical class that might involve harmful animal use. There's a growing momentum and success so that alternatives are now seen as the standard way of doing things in many departments. And it really is a win-win solution. Multiple positive impact exists. Students can gain the skills and knowledge more effectively. Teachers can pass on their own knowledge and skills more effectively. The professions can benefit, and so society can benefit too, as well, of course, as animals not being used in harmful ways. And the broader impact of sustainable development can be addressed as well. So thank you very much for listening. Apologies for the extra time, but I hope you enjoyed it.